I'm thinking of a word that resonates with you and with me. It's something we carry, often without thinking. It shapes how we live, how we love, and how we survive. Any guesses? That word is culture. One word, but so powerful. It reaches into how we celebrate, what we eat, how we mourn, what we value, and the tools of survival we pass on to the next generation. I am a Congolese final year medical student, and I'm here because those tools, those values, kept the people before me alive. And for me, culture is all of that. It's something I used to be afraid to question. So whenever something was recommended, like a remedy, I took it with full respect and no hesitation. And I know I'm not the only one. You've probably done the same. Trusted advice from family, especially when it came to health. Even the medicine we know today didn't just appear out of nowhere. It evolved because knowledge was passed down. But with the rapid pace of modern day medicine, we can sometimes overlook culture. We assume people have moved on from it just as fast as medicine has advanced, but they may not. In medical school, we are taught to assess patients in a structured way, take a history, ask key questions. But too often, we assume people live like us, think like us, and believe what we believe, but they may not. So why is it that some clinicians hold back on asking about culture? Fear of saying the wrong thing, worry they'll be misunderstood, or just not knowing how to without judgment? And I'll be honest, even as a medical student, I've made that mistake. Let me tell you a story. A friend of mine once asked me to accompany her to hospital, and just like we all do for those we love, I said yes without hesitation. But she was in agony, severe abdominal pain, constipated. We sat in A&E watching the clock tick, and I could see the panic in her eyes. The doctor asked, "Do you smoke?" "No, doctor." "Do you drink?" "No, doctor." "Any recreational drugs?" "Oh, I stay far away from those, doctor." "What's your diet like?" "I'd say I'm healthy." "Do you exercise?" "Well, I walk." All the usual. She gave brief responses. She felt reassured. The doctor didn't ask anymore, so I don't need to say anymore. So what was missing? Just one question. Have you tried? Are you planning on trying? Or do you regularly practice anything that you can share with me so I can better advise you? Because here's what she hadn't said. She'd been feeling weak, craving something she couldn't quite describe. She suspected she was mineral deficient. And we all have cultural practices, whether passed down through friends, family, or our social media communities. So, like many in her family before her, she turned to what felt familiar. It felt harmless. She ordered it online and took it until no more bowel movements. Now, I'm not saying that the remedy caused their symptoms. Maybe it contributed, maybe it didn't. But here's the point. No one asked about it. Not because the doctor didn't care, far from it. They asked everything they're trained to ask. And this happened in London, one of the world's most diverse cities, where 46.2% of the population comes from non-white backgrounds. But the space to ask about cultural practices, that space didn't exist. And the remedy she used is called Calabash chalk. So what is Calabash chalk? Calabash chalk isn't a blackboard chalk. It's not some form of flour, nor is it a clean white clay from a wellness blog. Calabash chalk is an earthly substance dug from specific soil sites across Africa. And in the diaspora, where people don't have access to these sources, people go by taste. That's how you know it's good. It can be smoked, unsmoked, salted, unsalted, and yes, it comes in many different flavors. Calabash chalk goes by many names across Africa and the diaspora. In Congo, where I'm from, we call it mabele. But some of you may know it as nuzu, ule, ebumba, and shile, and many more. In my community, it wasn't a secret. But it wasn't spoken about either. You would only know if someone used it if you were close enough to share in those cultural exchanges. And yes, I consumed it myself, without ever questioning it. To me, it was just a snack. I liked the salty taste. It sat on the kitchen counter, so naturally I assumed, oh, it must be safe. I know this might sound new to many of you, but this practice of eating from the earth goes back generations. I urge you to join me on this particular journey, one that showcases a historic account of this, often overlooked, but never forgotten. Picture this. You are on a boat. It's wet and it's cold. You haven't eaten in days, but the nausea and the vomiting won't stop. The heavy chains tug against your bones and each wave chips away at your strength and your body feels as if it's at the brink of death. You reach land and you begin to dig. You begin to eat from the earth, searching for something that tastes like home. A moment of relief, a moment of memory. But the people who captured you, they don't understand. They force masks on your face and label you a savage. This instinct, this practice was first recorded during the transatlantic slave trade among enslaved Africans across the Americas and the Caribbean. But I can't help wonder, were they simply trying to survive? Trying to nourish their bodies of something that they believed was mineral rich? Maybe the land was chemically different to their homelands. It's a big maybe, but it's worth thinking about. Because in Africa, this practice never stopped. It evolved. It became a part of traditional medicine, a part of everyday life. And one of the most well-known forms today, calabash chalk, used to ease nausea and vomiting during pregnancy, act as a nutritional supplement, soothe the skin, support spiritual and traditional rituals, and in some communities, signal possible iron deficiency. It almost sounds like a magic pill, doesn't it? There are so many practices that people hold on to, passed down like sweet treats. Today, I'm talking about calabash chalk. But I want you to think about something you're familiar with, something you've never really questioned. For example, have you considered using castor oil to help empty your bowels? Has burning incense become part of your daily routine? Have you considered betel nut chewing? Do you still hold your breath to cure hiccups? Or have you considered conjuring a turmeric shot to help ease the aches and pains? Some of these practices have been birthed through societal and colonial pressures, such as skin bleaching and waist training. These aren't fringe behaviors. They've existed for centuries. They're built on trust. But trust doesn't always mean truth. And tradition doesn't always mean safety. So I started asking questions, both as a future clinician and as a patient. If calabash chalk is so widespread and culturally embedded, why are we not talking about it in clinics? Are we trained to have culturally sound consultations? Or are appointments too rushed and vital details are missed? Is there a language barrier? Or are people simply afraid they'll be judged? And I decided to dig deeper. And what I found were serious red flags. Calabash chalk causes preterm birth, infertility, particularly secondary infertility, anemia, exposure to pathogens from raw soil, neurodevelopmental effects, and yet I could still buy it online, easily, no warnings, no safety leaflets, no public campaign. I realized that keeping people safe stretches beyond simple advice. We need to equip clinicians with cultural competency. We need to make health information more accessible. And we need to create spaces for non-judgmental conversations. And in that realization, I found purpose. For me, the remedy was calabash chalk. I consumed it until I started asking questions. What is it for you? What have you tried based on advice from family, friends, or social media? Would you feel comfortable discussing it with your doctor? And as clinicians, do we know how to create safe, non-judgmental conversations around culture? For those in public health, how do we make sure that the right messages reach the right people in the right language and in the right way? Let me offer a few suggestions on how we can start to bridge this gap. If we want healthcare to be inclusive and holistic, we need to equip the public, clinicians, and the wider system with cultural competency. We need to train healthcare professionals to recognize and engage with online and cultural health practices. We need to integrate cultural history taking in a medical school curricula. We need to provide accessible and inclusive patient education through trusted NHS platforms and community outreach. And we need to support healthcare professionals with online social media presences who educate their communities with empathy and facts. Because assumptions miss things, but questions catch them. So, culture isn't just something we inherit, it's something we carry, shape, and pass on. So whether you're in a clinic room, the classroom, in your communities, or someone like me navigating a mixture of these worlds, let's make space for conversations that bridge tradition and science. Let's listen with curiosity and not assumption, because in asking one more question, you might just give someone the safety to tell you the whole story. Thank you very much.